This orientation is intended as a primer for the 2016 Greater Worcester Community Health Improvement Plan, the individuals and organizations who are involved in implementing the plan, and the framework for implementation of that plan. Some of the organizations that are involved in the implementation of the Community Health Improvement Plan, or the CHIP, are the Central Mass Regional Public Health Alliance, which is led by the Worcester Division of Public Health, the Coalition for a Healthy Greater Worcester, and the Academic Health Collaborative of Worcester, a project of the Worcester Division of Public Health. Before we get into the actual contents of the 2016 Community Health Improvement Plan and the intricacies of implementation, it's important to look at where we came from and how the Community Health Improvement Plan got to the point where it is today. The overall vision for the Community Health Improvement Plan is to be the healthiest city and region in New England by 2020. And it's important that we begin by focusing on that vision because that is really the unifying drive for the different individuals and organizations who are involved in implementing the CHIP. And that is the overall overarching outcome that everyone is working towards, that is working on a CHIP objective or strategy. So how do we achieve this vision? How do different organizations and individuals who are all working towards that, who are working towards a healthier region, healthier city, healthier community, how do we make sure that we're leveraging what all of those different organizations bring to the table to be able to best achieve that vision? And the framework that we've used is to take all the data and the resources and the experience that's out in the community in different organizations, whether they're hospitals or the health department, academic institutions, community-based organizations, faith-based organizations, or just passionate individuals in the community. How do we sort of collect all of that and move it into something that is a coordinated, targeted approach to improving health? And the framework that we use for that is the Community Health Assessment and Community Health Improvement Plan, which we often shorten as CHA and CHIP. So what was the motivation to begin this process of a community health assessment and community health improvement plan? And to talk about that, we go back 5 years ago, before there was a CHA or a CHIP, where organizations were working often for the same end goals. They were working under similar areas or had similar priorities, but they were working separately and they were working in a fragmented way. Organizations weren't necessarily collaborating in the way that they could have been. They were inconsistently measuring impact, so the outcomes that one organization was using for a very similar program would be completely different from what another organization was using. And for that reason, they couldn't really show the impact that they were collectively having in their community. And often those organizations were competing for resources. So they might be working on very similar projects. And there is a limited amount of funding and political capital and social capital to get those projects done and to see progress made in those areas. And organizations that weren't working together, weren't at least aware of what the other one was doing, could be competing for those limited resources. So to go about changing that and really bringing different organizations and individuals and communities together to be able to work on this collectively, we began the process of a community health assessment, or a CHA. And the community health assessment at that time in 2012 had 3 organizations that were working on it: the Worcester Division of Public Health, UMass Memorial Medical Center, and Common Pathways, which is the Community Coalition. Those 3 organizations were the ones that came together and put the community health assessment together for the first time in 2012. And each organization had its own motivations for doing that, but ultimately wanted to see a more coordinated and better measured system of improving health. When the community health assessment was done in 2015, another partner was brought into that process, which is Fallon Health. And the community health assessment, which is sort of the groundwork and the foundation for writing a plan to improve health and health outcomes, synthesizes information from a lot of different areas, from quantitative data, I mean, the numbers or the facts that we have that already exist in our community. So what is the mortality rates? What are people dying of? What are hospitalization rates? Why are people going to the emergency room? That sort of information that's already collected about our communities. Let's take all of that information and bring it to the table for this report. But at the same time, let's go out and talk to community members, let's talk to key stakeholders who have a role in improving health in the community, and let's get a little more depth about what those the data and the numbers tell us about health and health outcomes. And we do that through focus groups and key informant interviews. In the last community health assessment in 2015, dozens and dozens of focus groups and key informant interviews were done to really get a better picture about information that can really only come from the community and really only come from the voices of people who are working on health improvement every day, or just working in the community, living in the community, who may be experiencing poor outcomes, or whose family members may be experiencing poor outcomes, and have important perspective on what that really looks like out in the community. And we also include surveys, and a number of different surveys are included as part of the community health assessment. There's a broad public survey that asks about largely what does a healthy community look like to you? What are the barriers to being healthy? What are the things that make it easy to be healthy in the city and in the region? But then also surveys on health behaviors. The Worcester Division of Public Health conducts a youth health survey in regional middle and high schools that gives really detailed and important critical information for understanding what the health status is of our community, and that's included as part of the community health assessment. All of that information is synthesized, organized, and brought back out to the community to prepare a report that really shows what our priorities should be over the next 3 to 5 years. And all of that in the community health assessment, again, lays the framework or the groundwork for the community health improvement plan, or what we call the CHIP. The community health improvement plan in its 2016 iteration has one goal, 3 core principles, and 9 priority areas. The one goal for this community health improvement plan is health equity, and I'll talk a little bit more about that in a moment. The 3 core principles for the community health improvement plan are to invest first in the community, to empower, listen to, and respect community voice, and to eliminate gaps between services. The 9 priority areas are racism and discrimination, substance use, access to care, mental health, economic opportunity, cultural responsiveness, access to healthy food, physical activity, and safety. So put simply, the one goal of the Community Health Improvement Plan, which is health equity, is the belief that all members of our community should have the opportunity to make the choices that allow them to live a long, healthy life regardless of their income, education, or ethnic background. There's a more specific description of health equity that's in the actual report of the Community Health Improvement Plan, but this really speaks to what we mean when we talk about health equity. A question that is asked a lot about the 2016 CHIP is how it aligns with other state, local, or national plans that are also aiming to improve health or to improve some aspect of health. And that was something that was considered when the plan was being written. So we have the CHIP, and it overlaps in a number of ways with local plans such as the Open Space and Recreation Plan, Mobility 2040, the Worcester Regional Food Hub Pilot Plan. There are state plans that have direct overlap with our Community Health Improvement Plan, including the Massachusetts State Health Improvement Plan and Governor Baker's Opioid Task Force report. There are national plans where a lot of the different strategies have specific overlap too, including Healthy People 2020, the National Prevention Strategy, the Substance Abuse and Mental Health Services Administration's Leading Change 2.0, the Health and Human Services Reducing Health Disparities Action Plan, Surgeon General's Call to Action on Walking, U.S. Department of Labor Strategic Plan, and there are also a number of private plans or programs that were used to align the work of the Community Health Improvement Plan, such as the Equitable Development Toolkit. To get an understanding of what is in the Community Health Improvement Plan, we have these case studies that I'll walk through for each of the priority areas that just digs deep into one strategy within each of those priority areas. But again, we have health equity at the center of our Community Health Improvement Plan. We have our 3 core principles: investing first in the community, empowering, listening to, and respecting community voice, and eliminating gaps between services, which we sometimes call there is no wrong door to accessing services. We have our 9 priority areas, and really all of them are working towards, all the work that's happening in those 9 priority areas or under those 9 priority areas are working through the lens of those core principles with the goal of health equity. That the work that's happening in access to care is ultimately to achieve health equity. The work in substance use is ultimately to achieve health equity, and those 3 core principles are the framework for the way that work is carried out. In 9 priority areas, often seems like a lot of priorities, and the question is asked, how prioritized are they if there are 9 of them? And we felt strongly as we were putting together the Community Health Improvement Plan, and the people who are around the table for that, which is a good number of community representatives, different organizations, and stakeholders, that to address any one area of the Community Health Improvement Plan, you really have to address the other areas. That you can't address substance use without also addressing safety and economic opportunity and mental health and cultural responsiveness. And you can't address physical activity without also addressing safety and cultural responsiveness and economic opportunity and mental health. And you can't address access to care without addressing racism and discrimination and economic opportunity and mental health and substance use, and really all the other areas. That there's so much overlap between each of those areas in ways that you might not even realize at first. That access to care and physical activity actually have a lot in common in the ways that they overlap in transportation, for example. So why don't we dig into the first one here, racism and discrimination. Every different priority area in the Community Health Improvement Plan has an aim. That is what the objectives and strategies within that priority area are working towards. So the aim of racism and discrimination is to improve population health by systematically eliminating institutional racism and the pathology of oppression and discrimination, by promoting equitable access to and use of health promoting resources in the community, and significantly reducing the structural and environmental factors that contribute to health inequities. The different priority areas are then organized into objectives. The racism and discrimination priority area has 2 objectives. One is to integrate health equity into all CHIP areas, and the second is training, development of a common language, and opportunities for personal and professional development. If you're reading the actual report, the document of the Community Health Improvement Plan, you'll see that there are more specific and measurable objectives that are written in here, but as part of this orientation, they're a little, this is a little more high level and general about what those objectives are, whereas in the actual report, for example, that second objectives has a specific target of training or supporting 500 leaders and being able to support this work. A case study, so this is a single strategy that is in this priority area, and this is strategy 1.2.1, is to identify and implement effective evidence-based training for cohorts of community and institutional leaders best poised to create substantial change within their community or within their institutions. Every strategy has a partner that's either identified or has been identified since the report was written. In this case, it's the Worcester Partnership for Racial and Ethnic Health Equity. Every strategy has a measure, so how do we know that we've made progress in this area? The measure for this strategy is the number of leaders that are trained, and every strategy in the report also has a rationale. So the rationale for this strategy is that facilitating ongoing training and dialogue in order to be deliberate in building staff skills to advance health equity is a best practice outlined in CDC's Practitioner's Guide to Advancing Health Equity. Usually, if there is alignment with other state and national plans or local plans, it's mentioned in the rationale section of the report. So substance use. This priority area has an aim of creating a regional community that prevents and reduces substance use disorder and its surrounding stigma for all populations. It has 5 different objectives, which are mostly aligned with particular areas of substance use. So one objective is to delay first alcohol use and reduce adult binge drinking. Second objective is to reduce youth and prevent increase in adult marijuana use. Third objective is to reduce fatal opioid overdoses. The next is to prevent use of other and emerging drugs. And the last is to reduce the use of nicotine delivery products. Like I said, all of these objectives have specific targets. All of them have the time frame of by the end of 2020 for this community health improvement plan. But some of an example of a target that's set in there is reducing fatal opioid overdoses. The target is to reduce the fatalities by 80%. And that is an aggressive goal to set, an aggressive objective to set, but for the individuals and stakeholders who are around the table to set that target and to write this section of the Community Health Improvement Plan, it was important that a really sort of drastic target was set, because that is really what reflects what a healthy or the healthiest community, the healthiest city and region would look like, is to see that much of a reduction. So for that reason, that is what the target and therefore the strategies are working towards. A case study that is under that particular objective of reducing fatal opioid overdoses, a strategy under there is to increase the use of recovery coaches to provide treatment options to overdose survivors. The partner that's identified for this is the Worcester Division of Public Health. Measures of success for progress measures are number of agencies using recovery coaches and the number of recovery coaches used. And the rationale is that the use of recovery coaches is a similar model to community health workers. It's been shown to increase compliance with or initiation of treatment and bridge gaps between hard to navigate services. So here you can see where within a single strategy you see the core principles of the Community Health Improvement Plan coming through, that we're trying to eliminate gaps between services. Eliminating gaps means using different strategies such as recovery coaches or community health workers. And you can also see here how a strategy in one particular area also speaks to work in other areas, that using recovery coaches can also increase access to care. Once we talk a little bit about economic opportunity, that priority area, you can see how hiring local recovery coaches and people from the community also supports that area of the Community Health Improvement Plan. So there's incredible overlap and just interplay between all of the different priority areas and the strategies within them that really support the work. The next priority area is access to care. The aim of access to care is to create a well-coordinated, respectful, and culturally responsive environment that encourages prevention of chronic disease, reduction of infant mortality, and access to quality, comprehensive care for all. There are 3 objectives under this priority area. That's how it is organized. One is to increase the number of providers at health centers. The second objective is to decrease rehospitalization and preventable use of the emergency department through no wrong door coordination. And the third is to improve cultural awareness, responsiveness, and competency of providers. This is really getting to, what are the things that are preventing people from accessing and continuing to access quality, comprehensive health care. Some of that is the number of providers at health centers. Some of it is the cultural awareness and responsiveness of those providers working in a very, very diverse city and region. And some of it is to look at the reasons that people are showing up in emergency rooms or in the emergency department or taking ambulances for preventable conditions such as asthma and diabetes, that the trips to the emergency room and the use of ambulances aren't, that a lot of that is preventable. So what can we do to make sure that we are linking people to the care they need up front so that they don't end up in the emergency department? One case study under this, one strategy under this priority area is to increase the capacity of schools through nursing services or school-based health centers to provide screening, testing, treatment, and referral to services for school-aged children. The partner would be regional school districts. Measure of success would be number of schools with updated policies related to screening, testing, treatment, or referral to services. And the rationale is that school staff, nurses, and school-based health centers are on the front line of early childhood and adolescent health and are often under-resourced. Being able to connect those sort of gatekeepers in the front line of where we're seeing young people be sick and get treated, that they can really connect those young people to the care that they need if the system allows that to happen. And a positive example of this is for sexual health services, that if a student in a school is in need of sexual health services, how is that school then connecting that student to the services that they need if it can't be provided there? If the same goes for asthma. If a student has chronic asthma, what is being done to make sure that that student has the resources that they need, or their family has the resources they need to manage that asthma, and what are the different resources that are being offered, and how are those connected to what's happening in the school? That's just one strategy that's under access to care. But as you can see, this again is looking at eliminating gaps between services. And the idea that there is no wrong door to accessing services. That just because something isn't offered in a school doesn't mean that that's the wrong place to be connected to it. That we should be a community in which we're connected enough that we can get whatever you need, you can be connected to that appropriate service. The next priority area is mental health. The aim for mental health is to foster a community responsive to the mental health needs of all populations, considerate of all ages and cultures, and resilient to adapt to changing environments and demographics. The objectives, there are 4 under this priority area, are to increase the number of culturally diverse mental health providers, establishing a long-term plan for community-inclusive mental health assessment. So when community health assessment is being done regularly, how do we have a real deep assessment of community mental health during that process? Training and education to reduce the stigma of mental health, and finally developing a collaborative care model. There are over 30 objectives that are under the entire community health improvement plan under those 9 priority areas. Some of them are very specific and some of them are very broad, and it's important that we have both, because there's some work is being done and can be supported and enhanced in the community, and there's work that hasn't yet started that needs to be a little broader or a little more high level before to initiate that work. And I think mental health is one area where we see that. You can see sort of very specific things like a long-term plan for community inclusive mental health assessment, which if you look through the report has more specific timeframes and timelines that go along with it, to something that's really, really big and for the sake of treating mental health would be a very different processes, developing a collaborative care model and ensuring that physical health and mental health are not treated separately, but are really thought of at the same time, and that treatment is coordinated. A strategy that's under this priority area is to identify and recommend best practices in culturally responsive mental health screening and referrals to help non-provider organizations screen and refer to mental health challenges. Some of the partners that have been identified or could be a part of this are U Inc., LUC, the Bridge of Central Mass, Central Mass Regional Public Health Alliance school districts, Community Health Link, and public safety agencies. A measure of success is written recommendations for how those agencies can screen and refer for mental health challenges. And the rationale is that there are social networks and social support in the area of mental health that is being provided by different agencies, or those agencies are gatekeepers or critical in the treatment of mental health and in addressing mental health, but aren't in and of themselves mental health providers or treatment providers, but have a significant role in what are we doing to make sure that all the organizations that have a role in mental health have the tools and resources that they need to be able to address the mental health needs of their clients or the community that they're interacting with, and making sure that it is more seamless in that way. The next priority area is economic opportunity. The aim of this priority area is to improve population health by providing all residents with opportunities to engage in meaningful work with living wages and healthy, safe, and family-friendly working conditions. This priority area is something new to the Community Health Improvement Plan in 2016, and it's an area that most of the other priority areas had, in some way, shape, or form existed in the last Community Health Improvement Plan, in the 2012 plan. But this is really a brand new area that came out of the community health assessment, where people said, if you ask people what a healthy community looks like to you, oftentimes we hear the response that a healthy community is a place in which I can get a job and that I know my children can get jobs when they're ready. And to really address and understand the implications and linkages between economic opportunity and health, it doesn't take a lot of digging to understand that connection, and we thought that we need to do a better job of bringing economic opportunity into the conversation of health and how that interacts with health outcomes, and also with all the other areas of the Community Health Improvement Plan. So whether it's access to care or physical activity or access to healthy food, how does economic opportunity support that, and how does our economic policies support or hinder health? So the objectives under this priority area are to make sure that there are employment resources available to underserved populations, to pass municipal and institutional policies that impact equity, to increase participation in English as a second language classes, and to increase participation in the transit planning process by health professionals and community leaders. So one strategy that is under this area is to encourage new and promote existing programs to increase the availability of affordable housing, such as affordable ownership opportunities and employer-assisted housing. Partners could be the City of Worcester Executive Office of Economic Development, the Housing and Development Division, Community Development Corporations or CDCs, and Central Mass Regional Planning Commission. In this strategy, a measure of progress would be the number of individuals benefiting from new programs or enhanced programs. And the rationale is really that there are a significant number of people in our region who are housing cost burdened, which means a disproportionate amount of their, or a large proportion of their income goes to pay housing. And that puts a significant stress and strain on that family's ability to be healthy in a number of different ways. And that if we can reduce that burden, and if we can make sure that there is housing that's affordable for people, that's really critical to see families maintain or gain economic opportunity and in turn remain healthy, because we know that without economic stability, being healthy is a lot harder. Affordable housing was one of the top 10 most commonly reported indicators of a healthy community by Community Health Assessment Survey respondents. So it was really important that it be included in the Community Health Improvement Plan. And something I should say is that the economic opportunity of the Community Health Improvement Plan is not all-encompassing. It doesn't try to address every different area of economic opportunity. It doesn't try to encapsulate or incorporate all the different work that's happening out in our community around this area, around economic opportunity. But it's looking at what are the few things that we should be targeting if we're thinking about health, and if we're thinking about health equity, that really can have an impact on health outcomes. The next area is cultural responsiveness. The aim of this priority area is to enhance the capacity of health and social service agencies to provide culturally responsive, culturally appropriate services to Central Mass Regional Public Health Alliance residents to improve health equity. The three objectives that this priority area is organized into is to adopt culturally and linguistically appropriate services standards for all service providers, that's health providers or just social service providers, increasing the number and use of interpreters at service agencies, and again, this is not just health agencies, but social service agencies as well, and local and state agency coordination, and just making sure that local agencies and state agencies are coordinating better to make to provide services that are well coordinated and seamless for the community. The strategy that is a case study under this priority area is to increase the capacity and resources for cultural organizations and faith-based organizations to participate in regulatory decision-making processes and to improve services in order to become more culturally responsive. So this strategy is really looking at how do we get community-based organizations or cultural organizations, faith-based organizations who have good understanding and representation of their community be a part of decision-making processes more often, and provide input into decisions that are being made about how resources are allocated or how services are provided for the community and for different populations. Partners in this could be cultural and faith-based organizations. Measures of success are the number of new cultural and faith-based organizations who are engaged in regulatory decision-making processes. And the rationale is really that we have an incredibly diverse region. It's one of our greatest strengths. But that poses a challenge for social service providers to be able to properly address the needs of the entire community and all the communities within our community. And we need to make sure that those organizations who are doing that work and who are working closely with different populations and communities within the region, that they are able to bring community voice to the table when decisions are being made, and can contribute to how resources are allocated and how services are provided. Next priority area is access to healthy food. The aim of this priority area is to ensure that all people have equal access to healthful foods by building and sustaining communities that support health through investment in the growth, sale, and preparation of healthy foods. This priority area is organized into three objectives: increasing participation of eligible individuals in federal food programs, removing barriers to access produce, and increasing school and community nutrition and garden programs. And again, those objectives have specific and measurable language around them in the full Community Health Improvement Plan report. One strategy within this priority area is to increase the number of farmers markets accepting the SNAP and WIC, Supplemental Nutrition Assistance Program, and the Women, Infant, Children Nutrition Program, to make sure that healthy food at farmers markets, fresh produce, is affordable and available and accessible to people who use those programs. Partner agencies would be the Worcester Food Policy Council, the Regional Environmental Council, and also regional boards of health who may be able to pass policies to encourage the use of SNAP and WIC at those outlets. Measures of success include the number of farmers markets accepting SNAP or WIC, and the rationale is that farmers markets can be an important point of access for communities to access healthy, fresh, local produce, and making sure that those markets accept SNAP and WIC allows them to benefit from that access, but also from federal and state, local, federal, and state matching benefits that are already in place or soon to be in place for residents. The next priority area is physical activity. The aim of that is to improve health for those who live, work, learn, and play in the region through safe, equitable access to opportunities for physical activity, with special emphasis on youth, vulnerable, and underserved populations. The objectives under physical activity are to enhance access to physical activity resources, to engage population in walkability activities, and to engage the business community in walkability. Our case study strategy under this priority area is to ensure that every public elementary school has access to a safe place to play and increase access to existing play facilities through joint use agreements. Partners could be the Worcester Division of Public Health, working for Worcester and the Worcester Public Schools. Measure of progress is the number of new recreational facilities open to the public. This strategy is really looking at how do we ensure that there is equitable access to safe places to play for all children in our region, and making sure that those resources aren't just open to children when they're at school, but also for the communities and families who live around schools who can access that after school hours. So the last priority area is safety, the aim of which is that all residents, regardless of age, race, ethnicity, class, gender identity, sexual orientation, housing situation, family status, or religion will feel safe, secure, respected, and live a life free from violence. This priority area has 4 objectives that are broad and cover many different areas of safety, but include improving the built environment, decreasing youth violence, increasing positive police and community interaction, and better assessing interpersonal violence. Our case study strategy under this priority area is to implement an intervention for young children who witness violence to support positive social and emotional development. Partner is the Worcester Youth Violence Prevention Initiative, and all the partners, community organizations, and otherwise that are a part of that initiative. Measure of progress is the number of young children engaged in the intervention. And the rationale is really that research has shown how much trauma, particularly in early childhood, has detrimental effects on a number of different areas of that child's life, including brain development, fear response, impulse control, and academic learning, all of which have incredible effects on that child's life and even into adulthood, but has particular effects in health outcomes and health behaviors. And this is yet another example of a strategy that, while is in safety under this priority area in the Community Health Improvement Plan, has implications in so many other priority areas, in substance use and mental health. And this is really the power of having a community health improvement plan where the partners are working collaboratively and interacting and having cross area communication to be able to discuss how to really support health at a root cause level in our community and try to see more positive health outcomes across the board. So that was a very quick overview of the 2016 Community Health Improvement Plan, and there's, like I said, over 30 different specific and measurable objectives that are in there that you can find all of those in the report, and 100 different strategies that are under those 9 priority areas and over 30 objectives. So how do we possibly implement all of these different strategies in a 4-year period? That was a question that we asked ourselves as the Community Health Improvement Plan was being written, and the answer for all the people who were sitting around the table was to restructure an organization that is now known as the Coalition for a Healthy Greater Worcester, or the Coalition for short. And we really see the coalition as a framework for a successful implementation of the Community Health Improvement Plan. One of the areas we thought a lot about when this was all being put together was accountability. That you have a huge plan that has hundreds of partners that are involved, 100 different strategies, 9 different priority areas. How do you keep this accountable? And it needs to be accountable to the Worcester Division of Public Health, who has a particular stake in seeing this work carried forward and understanding what the progress is and what success looks like. There's certainly a level of accountability to UMass Memorial Medical Center, who not only supports the work with resources of time, but resources of money, and has a stake in the community health assessment and ensuring that there's progress that happens between community health assessments, to funders who are the ones who are funding the different programs and initiatives that are aligned to the Community Health Improvement Plan, and understanding what success is looking like for them and what impact they're all having. For the community partners, for the same reasons, really understanding what their impact is and the work that they're doing, and collectively what their impact is altogether. As I was saying 5 years ago, if those community partners weren't working together, weren't somehow aligned, and have common measures of success, it's hard to tell the story of the impact that you're having. But when we work together and we have a more accountable system, you can say that even if programs are working with different populations or working in slightly different ways, that if you have a unified measure of success, it's a lot easier to tell that story. And finally, to the community, we constantly ask the community, what does a healthy community look like to you, and get input and feedback about these plans and about the measures that we're looking at. And we want to make sure that we're accountable to them in that, and providing updates on the success of it or the challenges, and hearing from the community about what they see as the successes and challenges to this work, and what is progressing and what isn't. And the answer to that question of accountability we've seen is in the Coalition for a Healthy Greater Worcester. And this is an organization or a coalition of different individuals who are responsible for really overseeing the implementation of the Community Health Improvement Plan. Some of the benefits we see in this model is that they have expertise in community engagement and dedicated staff. So they have individuals who are constantly out talking with the community and understanding from community partners what successes and challenges they're facing, sharing accountability with the Worcester Division of Public Health, being a conduit for resources, making sure that the Community Health Improvement Plan has the resources that it needs to be successful, and a greater opportunity of transparency for the community, that there are so many different organizations and individuals who are around the table for the Coalition of a Healthy Greater Worcester. The process is much more open and transparent for everyone to be an active participant. So the structure of the Coalition for a Healthy Greater Worcester, there is a steering committee, and that steering committee consists of 2 co-chairs. There's one community representative as a co-chair and one Worcester Division of Public Health representative as a co-chair. There are 9 Members of the steering committee that are priority area representatives, they were selected by recommendation during the CHIP planning process. There are 4 subcommittee chairs, and we'll talk more about the subcommittees in a moment, who were members of the transitional steering committee who brought about the Coalition for Healthy Greater Worcester, and ex officio or non-voting members, which include the YWCA, which is the fiscal agent of the coalition, the Mass Department of Public Health, and the coalition's treasurer. Coalition for Healthy Greater Worcester operates with 4 subcommittees. One subcommittee is the Policy and Advocacy Subcommittee. They promote the policy change work necessary to move the CHIP forward and engage policymakers. The people in this subcommittee are the ones responsible for ensuring that the community organizations or the different CHIP partners who are working on the Community Health Improvement Plan have the resources they need to be able to see policies change or be influenced in order to support the work that they're doing, and to see the greatest impact of the work that's happening in those areas. The Resource and Development Subcommittee is responsible for growing the fiscal capacity of the coalition and is also responsible for developing a mechanism for grant making. The Coalition for Healthy Greater Worcester does have funding resources to support the work of the different community organizations who are a part of implementing the Community Health Improvement Plan, and this subcommittee is responsible for developing that mechanism for releasing those funds, but is also responsible for understanding what the gaps of resources are for different CHIP objectives and strategies to be able to be implemented within the timeline of the Community Health Improvement Plan. The Community Engagement Subcommittee is really critical and one of the most important parts of the Coalition for Healthy Greater Worcester. They're responsible for engaging the community to participate in the CHIP, for conducting focus groups and interviews, and bringing the voice of the community to coalition work. And this work is so critical. It's not just in evaluating the work that's happening, but also in making sure that a strategy that's going to be implemented is done in the best possible way. And an example I always use for explaining sort of this work and why it is so critical is a number of years ago, the Worcester Division of Public Health had a grant to improve access to healthy food for seniors. The initial proposal that the Division of Public Health developed was to basically have a food produce delivery system or a model that would go to senior housing in the senior center, where seniors could order ahead of time what produce they were interested in, and that would either be local produce if it was available, or directly from a distributor of produce. It was basically a Peapod for seniors. And a focus group was conducted before it was actually implemented, and the seniors there were 3 different focus groups, all in different languages, for seniors in senior housing and at the senior center. And the response was basically, this is a terrible idea, we don't like it, and we won't participate in it. And because of that focus group, it really changed the way that program looked, and a completely different model was set up, so that there was frozen vegetables, that there was processed vegetables, so vegetables that were chopped or in smaller portions, and those were really the things that seniors were looking for. And while it was a great thought for how to increase access for that population, without doing that community engagement, the program wouldn't have been right and probably wouldn't have been successful. But with that community engagement, those resources were able to be leveraged or leveraged for a program that was more acceptable by the community and integrated community voice more. The final subcommittee is research and evaluation. It's critical not just for evaluating the work that is happening with all of the different objectives and strategies of the Community Health Improvement Plan, but also to make sure that those strategies are being implemented to, if there's evidence for those strategies, what that looks like, what it, have strategies that implemented in different places around the country, and what does success look like there, and what are those lessons that could be learned and leveraged for the work here before that happens or while it's happening. And also in conducting ongoing community health assessment and doing the CHA every 3 years. The idea of this model is that there are, under each priority area, there are organizations and individuals who are already doing the work. In this visual, in this example, those organizations would be here. So the Regional Environmental Council, the Worcester Food Policy Council, UMass Memorial, preschools are all example of organizations who might be doing work under Access to Healthy Food, just for an example. And while they're all doing their own individual work, their work plans, a lot of that work falls under the Community Health Improvement Plan and is in alignment with the Community Health Improvement Plan. So there's one DPH staff member and there's one Coalition Steering Committee member rep who are really responsible for gathering those people together from the different organizations, saying what is the work that's happening, what resources are needed to be able to achieve the objectives and strategies that are outlined in the Community Health Improvement Plan. How does that best align with the work that you're doing around this area? And does that on a quarterly basis, brings people together, just reports out on the information that's already happening. The idea is that we're not creating new work groups. We're not creating a work plan among all these organizations to do specific work that's outside of the work that they're doing. They're really figuring out what are the gaps, what are the needs of these organizations to be able to carry out the work that's outlined in the Community Health Improvement Plan. Or if there is no organization who's working on a particular strategy of the CHIP, how do we grow capacity of existing organizations, or what do we do to really achieve those strategies? And just calling people together and being sort of points of communication and contact for that to happen. Another sort of visualization of this flow of information is that we have all these different priority area partners who are out there doing work. We get them together quarterly in what we're calling a report out, where everyone just comes together and shares what work that they're doing around the different CHIP priority areas, objectives, and strategies. At those meetings, there's a Worcester Division of Public Health staff member and a Coalition Steering Committee member who sort of collects information, understands the resources that are needed to best carry out that work, and brings that information to the Coalition Steering Committee. Coalition Steering Committee then synthesizes the information that's coming from all the different priority areas, can have a good picture of what the needs, challenges, or successes are from all those different areas, and can then feed that information to the coalition subcommittees. So research and evaluation, resources and development, community engagement, policy and advocacy, and then that information can be used to set work plans for those subcommittees, and hopefully those work plans will lead to action and outcomes. And those outcomes are really to support the work of those priority area partners and making sure that the organizations that are doing work under any of the different priority areas have the resources, whether those resources are community engagement or funds that might come out of resource and development, or advocacy that comes out of the policy and advocacy subcommittee, that they have the resources they need to achieve the outcomes of the Community Health Improvement Plan. In some cases, there are existing coalitions that are sort of doing that work of calling people together. Examples of that are the Worcester Food Policy Council, the Worcester Partnership for Racial and Ethnic Health Equity, and the Regional Response to Addiction Partnership. Those are existing groups that'll hold those quarterly report outs. The groups aren't necessarily responsible for implementing every strategy. They may choose to implement some of those strategies in those priority areas, but they're ultimately responsible for keeping the pulse of the priority area, understanding what's happening, what's not happening, what resources are needed to achieve all of the different strategies and objectives that are outlined in the Community Health Improvement Plan. Finally, the Academic Health Collaborative of Worcester is another sort of structure or model that's put together to see the work of the Community Health Improvement Plan achieved. And the idea is that it's a partnership between the Division of Public Health and specific academic partners, at this time UMass Medical School, Clark University, and Worcester State University. Those partnerships, the formal partnerships between the division and those academic institutions, are supposed to match the need of different public health initiatives and projects have with faculty and student interest in public health. If there's research or involvement that students or faculty want in public health, that interest and passion can be met with the actual needs of implementing different public health programs. Some of that is done through internships, some of that is done through long-term projects that are carried out through faculty engagement, but the mutual benefit is improved health, hopefully from the outcome and the impact from those projects, and also a more experienced workforce from the students and faculty who are involved. So with all that information, how do you get involved? What are the next steps for getting involved in the Community Health Improvement Plan or the Coalition? So you can learn more. You can go to the Coalition website, which I'll show in just a moment. There's a Coalition Connection newsletter, which you can sign up for on the website. You can complete a chip-in form that's either in paper or online, also found on the website. And those chip-in forms can be done for individuals who are interested in participating in the Community Health Improvement Plan or for organizations. Getting connected, so attending meetings, attending events, all of that is found on the Coalition website, on the calendar page, and also spreading the word, so making sure that people know about the Community Health Improvement Plan, making sure they know about this orientation and have an understanding of what work is happening out in the community. So if you go to healthygreaterworcester.org, you can find there, that's the Coalition for Healthy Greater Worcester website, healthygreaterworcester.org. You'll find the Coalition mission, vision, the people who are involved, the organizations who are involved. You'll find the full 2016 Community Health Improvement Plan report, the document, and then also a live document where we track some more up-to-date information about that. You'll find chip-in forms, which is sort of our commitment forms for being part of the Community Health Improvement Plan for both individuals and organizations. The calendar of meetings and events that's always kept up to date, the most up to date you'll find for all of the different CHIP-related events or meetings. It's an access point to the Coalition Drive. All Coalition meetings, minutes, documents are all part of that drive and are publicly accessible. The idea is that it's open and transparent, and anyone can see, what work has already been done, and hopefully that can facilitate people sort of jumping right in. And you'll also find a place to sign up for the mailing list to receive the Coalition Connection. It happens once a month. It highlights some of the work that's being done, some of the upcoming meetings, and some of the successes that are being seen with the implementation of the Community Health Improvement Plan. And thank you for joining this webinar, for learning more about the Community Health Improvement Plan and the Coalition for a Healthy Greater Worcester. It's really critical that we all come together to be able to see health improve and to see the outcomes that we want for our community and to be the healthiest community that we can be. Thank you.